Dear students, I hope you remember GAME. What is GAME? Gross and microscopy explained. And since we are towards the end of systemic pathology, thyroid is important. We shall go to one particular lesion, namely the papillary carcinoma of thyroid. The tumors of the thyroid have already been covered in R.A.T.S. So you people should read the R.A.T.S. And also the other subjects where it is important are given here. The modes of questioning are also mentioned. I hope you people are able to find some fine fibrillary structures within an organ. So this is called papillary. The word papillary means finger-like projections. So let us go to papillary carcinoma of the thyroid. So it's a beautiful specimen of a thyroid, and on removing, probably they have done a hemithyroidectomy and they have seen that there is a tumor over here, or this would have been diagnosed by means of an FNAC, fine needle aspiration cytology. And what is the description? The thyroid, it shows a circumscribed tumor. Circumscribed is not capsulated. It is somewhat demarcated, but not capsulated. And if I look at it carefully, it is friable because of delicate branching and rebranching pattern. Grayish white in color. And the tumor measures so many centimeters in diameter. And of course, we should mention the rest of the thyroid, which is somewhat pinkish brown. So this is a gross description. This might not be kept, but it is just for a recapitulation of your thyroid tumors. And how can we describe such a thing? Usually the students have got a lot of difficulties. Two components I am seeing. All this is tumor. The bluish ones means more nuclei, so tumor. And the pinkish one is fibrocollagenous septae or bundle. So this is a tumor. And I find that it has got a projection, a finger-like projection. And here, sometimes you find that they are branching, they are anastomosing, joining together. So this is a typical picture of a thyroid tumor. And look at this one. It is a tree, an arboriform pattern. I think we can compare. So there is a trunk, the branch, it branches, rebranches, small twigs are there, and then the leaves of the parenchyma. It has got exactly this kind of an appearance. So it is called an arboriform pattern. So that is over here. And the description, I mentioned it for you people. The tumor is composed of multiple branching and rebranching papillary or finger-like processes. It has got a tree-like pattern or an arboriform pattern. Anastomosing in some areas. There is a central fibrovascular core. We shall be seeing this later. Repetition is the mother of knowledge. Fine. Look at this one. If you are getting this in your exam, you are lucky with the slide. So there is a normal thyroid with the follicles, thyroid parenchyma, whereas this is a papillary carcinoma. These are all cut surfaces of the papillae. And in some areas, there are bluish areas, homogeneous and dark, which are areas of calcification called psammoma body. So these things, people can be able to describe it very clearly. And these are all the cut surfaces, as though you have cut your fingers. It appears exactly like that. And this almost empty looking are the nuclei. We call that as a ground glass nuclei or an orphan Annie nucleus. Look at the nucleus over here. It has got exactly that picture. So it is described as an orphan Annie nucleus. And the rest of it is the epithelium. That is the cytoplasm around it. In the center, I am able to see a fibrovascular core. So nuclei are there, which is over here, and this is the psammoma body. I hope people will be able to make a mention of all. And another pattern. This again is a cut surface. I am able to see a fibrovascular core. There is a tip of a large arrow. And there is a nuclear grooving that can. Look at this one. It is having a coffee bean-like appearance or a nuclear grooving. There are some tumors which will be having this grooving. This can be asked as an MCQ, and if you answer, you get a mark for it. Granulosa cell tumor of the ovary, another tumor where there will be nuclear grooving. Brenner's tumor, coffee bean appearance. This is a nice mnemonic I picked up. Where all can you see Samoma bodies? Usually asked in the MCQ or in the Viva. Samoma bodies seen in Pap smear. So this is supposed to be Pap smear. PA is for papillary carcinoma thyroid, P for pituitary adenoma, S for serous papillary carcinoma ovary, ME meningioma, A appendiceal carcinoid, R renal cell carcinoma. And this is the concentric deposition of iron and calcium. So it is a pathological calcification that is seen as a Samoma body. If that is difficult for you, remember PSM. It is not preventive social medicine. It is papillary carcinoma thyroid, serous papillary adenocarcinoma ovary, and meningioma. Please do remember these. More the better. And this is the explanation for the Samoma body. Gracias.